Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest is generally the whole mouth. We've got teeth with severe periodontal disease. On the panoramic view, you can very clearly see that there is generalized bone loss. We've got aggressive periodontitis all over, and we've got very mobile teeth. Now, we're going to take you through each and every segment from the transaxial point of view. Our initial assessment of the transaxial view is that there is bone loss significant enough for in every tooth, around every single tooth, that implant placement does not seem to be favorable in such a patient. Now, this is the transaxial view of the upper right 7. As you can see clearly, very severe bone loss. Moving to the interradicular area between 6 and 7, again, such severe bone loss which is perforating the sinus floor and causing sinusitis. The upper right 6, relatively better bone support. Then we've got the upper right 5, again, severe bone loss. Moving to the 4, better bone support. The 3 has bone support, but the 2 has very minimal bone support. There's severe bone loss. The 1, again, very severe bone loss in the anterior central incisors. There we go. The anterior lateral incisor again has significant bone loss. The upper right canine has significant bone loss. The upper left premolar has better bone support. The upper left second premolar also has better bone support. The upper left molar has good bone support generally, but the upper left side has better bone support. The lower right, we're going to focus again, has significant bone loss. The lower right 7 has significant bone loss. The lower right 6 has significant bone loss with very apical radiolucencies. We've got the lower right 5, which has again significant bone loss. We can see here. The lower right 3 also has significant bone loss, which can be seen here with very apical radiolucencies. The anterior segment has minimal bone, and this is not good bone for implant placement, but can be engaged with a mini or a shorter implant. This is the lower left 3, relatively better bone support, but lingual side has severe bone loss. Lower left 4 has better bone support than the right side. Then the lower left 5 again has severe periodontal disease that we can see right here. So we don't see areas for implant placement, and we don't see, this is the lower left 6, again thin ridge bone defects, roots have present. Left 7, again no height between the ridge and the inferior alveolar nerve. So if there are any further questions, please feel free to reach to our team. We would be extremely happy to help. This is the axial view of the mandible, and this is the axial view of the maxilla. As you can see, the lower upper left segment of the maxilla is still better bone supported than the upper right segment. Thank you.